Excellent. So welcome everyone to the Revere Board of Health public meeting for the month of April. First, can you please rise for the Pledge of Allegiance? Great. So I am Dr. Drew Bunker. I'm the chair of the Board of Health, and with me today are two other Board of Health members, Kathy Savage, and then Viviana Catano, who's here for her first time on the Board of Health. Also, municipal staff Michael Wells, who's the Health Agent and Director of Inspectional Services, as well as Paula Sepulveda, who's the Board of Health Clerk. In attendance, we also have Attorney Anthony Bronco. Just briefly, just because this is Viviana's first meeting, I'm going to ask her if she just mind just saying a few things just about herself and what she looks forward to in working in the Board of Health.
Hello everyone, my name is Viviana Catano. I work for Mass General Hospital. I have been working for the hospital under the Revere Cares Coalition for over 13 years. The coalition works to implement public health initiatives in the community. We work with residents and leaders to identify issues in the community and address these issues through collaborations. I previously led the alcohol, tobacco, and other drug task force in the community, so I'm very well versed in prevention science and implementing policies that help especially young people make healthy choices. Currently, I co-lead the Food Working Group, which is an initiative that came out of the Mass in Motion funding. And Mass in Motion is about implementing policy, system, and environmental changes, again, to help residents eat better and move more. So this is the experience that I bring into this group. I also live in Revere. I'm raising 2 kids here, and I care about what happens in the community, and I want to make sure that the policies we're implementing are, helping people to make good choices around their health. Thank you.
Great, thank you. We're happy to have you. Great, so the first thing we'll do in every meeting is we review and approve the minutes from the March meeting. So, because it was just Kathy and I, so Kathy, I'm just gonna ask you, do you approve the minutes? Oh, sorry, Viviana can approve them as well.
Yes, I approve of minutes.
Yes, I approve of the minutes.
Great, thank you. Next is gonna be the Inspectional Services Monthly Report from Michael Wells.
Thank you, Dr. Bunker. Board of Health inspection numbers for the month of April are as follows. For the Interior Housing Division, we completed 37 certificates of fitness, 10 re-inspections on certificates of fitness, 12 interior complaints, 9 interior re-inspections. We had 12 interior complaints. We had 9 re-inspections on interior complaints. We had 3 pool inspections. And then on the Food Inspection Division, we performed 38 routine inspections, 13 re-inspections, 3 complaint inspections, and 2 pre-opening inspections. On the Exterior Sanitation Division, we issued 321 violations for trash, 30 for improper bulky items, and 27 for accumulation of trash and litter and debris. And we issued 1 violation for working without a permit.
Great, thank you, Michael. Next is we're going to discuss the condemnation proceedings regarding 71 Pitcairn Street. I'm going to have Attorney Anthony Bronco come up to the front here and speak. Thank you.
Thank you, members of the board. Attorney Anthony Bronco. I serve as outside counsel for the city of Revere with respect to public health and safety issues in the city. So we're here before you for a matter of condemnation for 71 Pitcairn Street. This is a property that the city actually believed to be vacant for over a year. Came to the city's attention in January of 2023. There were complaints from the city, from neighbors regarding, a Jeep that had been parked in the driveway for a long time, uncut grass, rat infestation, so the city in good faith tried to reach out, as Mr. Wells pointed out, they do exterior and interior inspections. They requested an inspection of the property. They sent, I think, 5 or 6 inspection requests between January and April of 2023 and received no response. They sent, I think, 8 or 9 fines between January and August of 2023 and again received no response. Based on that, the matter was referred to outside counsel in March of 2024. My office then got a letter out to the property requesting an inspection of the property. We received no response. And so what happened was our office, we obtained a warrant from Chelsea District Court to go in to perform an inspection. The day before, Mr. Alan Bossel, who is here today and will speak on his own, to the merits of his arguments, he explained that he was living at the property. It was not vacant, it was not abandoned, and he was a gentleman. He cooperated and allowed us to go into the property. At that time, what the city found, though, was there were a number of issues that rise to the level of making the property unfit for human habitation. I provided the board members as well as Mr. Bossel with a brief outlining this. Within that brief, as Exhibit D, I think, is the order to correct. So that's an inspection report that the city issues after an inspection. It's under 105 CMR 410, which is the state sanitary code. And so what happened was they found a number of issues, including no running water. There are portions of the property that are without heat and electricity. I think it's just the attic and the basement, but that still stands. There's inadequate fire protection there. There is a partially or illegally constructed unit in the attic consisting of some sort of bedroom and cooking space, I believe, as well as the rodent infestation, which, is apparently stemming from or is centered around the property. So given all this, even before the inspection report was issued, we sent a letter out to the occupant asking him not to stay at the property anymore, saying, for your own health and safety, please, if you have another place to go, go, and what we'll do is we'll put this before the Board of Health, for a condemnation hearing on April 25th. Pursuant to a conversation we had a few days ago, and he just confirmed just a moment ago with me, he's no longer living at the property. He is going back and forth to move possessions, which is understandable. You can't move everything out, on one day. But he's no longer living there, which is good. That's what the city wants. At the same time, though, we can't unsee what we saw. The Board of Health is now on notice that there is a property without running water, with inadequate fire protection, portions that don't have heat and electricity, a rat infestation. These are things that under, 410, I think it's section 630, it basically states that these shall always be conditions which material impair health and safety. Based on that, I would be asking the Board of Health to issue a finding that the property is unfit for human habitation in 2 orders. The first order would be to vacate the property, which has already been done, but it would formalize that. And the second being to secure the property. What I can say is that houses that look abandoned, and someone ends up moving in, trespassers. So what we want to do is we want to preempt that. We want to make sure that the property is secure, and to make sure that any possessions that the occupant has there still are secure. And so we're cognizant that, the effect that this order will have on the occupant. This is a case where he's stated that he's not necessarily living at the property. He's able to live somewhere else, but should that no longer be the case, he won't be able to go back to this house. The city is not unsympathetic to that. What we've done is we have now preemptively filed a petition to enforce the state sanitary code and to appoint a receiver in Easter Housing Court. So what that will do is hopefully that will have a receiver be appointed. That receiver will have the wherewithal to go through and fix this property, bring it back up to code, such that the condemnation order can be lifted. Should Mr. Bossel need housing, the receiver will be empowered by the court to go find him housing and put him up. The other issue is that I'm not sure that this work can be done by any person that's not a receiver, given the fractured title. The last record owner died in, I think, 2021, and his estate is fractured in as much as 6 different pieces. So I think that there would need to be some sort of consensus to either sell the property or to do the work, right? So based on that's why we filed a receivership case, hoping that the receiver can go through and try to help and work in tandem. The last thing I'll say is that, I was made aware of this just, not long ago, that Mr. Bossel has enlisted in certain social services to try to assist him. We appreciate that. That's more than a lot of people do in this situation. He's seeking help, and so it's been represented to me that they may be able to do the work to bring this up to code. If that's the case, the Board of Health can go through and can lift that condemnation order in whole or in part as soon as that work is signed off on. And Mr. Wells is here with me too. You know, we both work very closely with the building and department, right, trying to go through and get permits and everything. We can expedite permits. We can work with contractors. We can try to get this done so they can get back in there if they're willing to move. But even based on that, what I would say is, like I said, the Board of Health can't unsee the violations that is before it, and I would still recommend that the finding in both orders issue. Thank you.
Yeah, good evening. All I can say is that I've been living in that house for the past 25 years, with my parents and everything. And when they passed away, I had nowhere else to go. I mean, I've been staying overnight with my fiancée, but I can't live with her because she's on housing in Section 8. So I'm not allowed to live with her. So that's why I was staying a lot of nights in the old place, because I had nowhere else to go. The things that were done without permits, I didn't know about. My stepfather took care of everything around the house. So it's just, in a way, it feels like I'm being punished for what they're doing, what they've done in the past. And 'cause my brother's name was on the deed and my stepfather's name was on the deed. So the house was to go to their next of kin, my brother's daughter and my stepfather's grandson, because both his kids passed away. So no one's giving me any answer of what's going on. I'm not getting phone calls or anything, so everything's up in the air. I don't know what's going on.
So it's great that you're working with plan to work with some social services. Is it feasible to get those social services going, and do you plan to hopefully be able to go back in the house? Because we have enough information at this point that I think from a legal perspective, we have to condemn the property.
Right.
And so I just want, we want to help you though. We don't want you to, we understand you lived there for as long as you did, and this is your only home,
Yeah.
but is it feasible to work with these services and see if we can reverse the condemnation?
Yes.
Okay.
I mean, take all the help I can get.
Okay. And, as hard as it is to go ahead with this, we want you to, at the end of the day, I feel very strong that people should have housing and deserve that right. So we want to help you in any way we can. But I think from a legal perspective, we have to do the condemnation, and it's awful for me to say, and I hate to think about it. It is reassuring though that you have somewhere to go, although it's not your home, and it's not an ideal situation.
Right.
Yeah.
And I'm afraid that if something happens, we get in an argument and she kicks me out, I have nowhere to go.
Yeah. That's where it gets, yeah. So that's why I think we need to get things going as quick as possible.
Yes.
And any way we can assist you, and be there when things are, able to be lifted, we should do it as soon as we can. And I think these are fixable things. This is not, nothing I've heard so far has told me that, it's done, we can't. I mean, there's electricity, so
Right.
there's
There's electricity, it's
there's
just
no
water.
there's no reason why we can't get, heat.
Right.
There's the water issue. I can't see why we're in the city of Revere. I mean, I can't see why we can't figure that out and get you support to get running water.
Right.
These
Because
are
I talked to a plumber, he said it would cost me, if they had to cut through the ceiling between the first and second floors to get to those pipes,
Yep.
and the pipes in the basement, he said it cost me $16,000 to $20,000. I don't have that.
yeah.
I'm
so-
on disability.
Yeah, so I think that's the where you need to bring in the social services, and it's unfortunate that we're at this point. I wish it could have been done preemptively, and I'm sorry that we're at this point where it's okay, now you gotta go, but I think things can move quickly if you want them to move quickly. And we'll be here to assist you in any way we can.
Okay.
Yeah,
All right, thank you.
okay, thank you. Yeah, so I think I'm going to vote from a legal perspective that we do have to condemn the property. But we will, this case is not done and ended here. We'll be supportive and work on getting you back to that property, because you've been there, and I think it's very possible in talking with the attorney today that can be done. So I'm gonna, yeah.
Dr. Bunker, on a positive note, and a condemnation is certainly never the road that we want to go down, as we do feel for you. However, this is not a property that we're talking about that needs to be demoed, right?
Yeah.
You know, it's a property that needs to have some improvements made to the electric, the plumbing, and some interior work. So that is a positive, that it's certainly not a case where the house needs to be demolished and rebuilt. So
Yeah.
I think, once a receiver is appointed, the work should move pretty quickly, especially with cooperation from everybody involved. And we can certainly help the receiver and get the permits expedited, to get them in there as soon as possible to get the work going once the receiver is appointed.
The receiver, where do they get money to make these adjustments? There's just a question.
So what happens is the receiver is able to, they're able to borrow money, or sometimes they self-fund, and at the end, they have a priority lien on the property. With some of the calculus that goes into, on our end, it's the city's end, requesting receivers, figuring out is there equity in the property. By our estimation, there is. And really, at this stage, it sounds like this is kind of the only shot there is to get this thing resolved. Again, now, so we have filed a receivership case in housing courts. We expect that case to move quickly. But on the other hand, if, Mr. Boswell is able to get social services involved, if they start pulling permits and start fixing things, we can certainly pull the receivership case. But what I don't want to do is to have him go all the way through with the social services, find out he's not ineligible for some kind of program or whatever, and then we're starting from zero and the clock's run out, right? So my sense would be to push on every front. We can always put the brakes on something, but it might be too late to start later on. So that would be my recommendation.
Okay, great, thank you. All right.
Can I just ask a question, because
Yeah.
this is my first time? Can you just briefly explain who the receivership is? Is it a state employee, a city employee? Who's the receivership? And so it sounds like if the receivership is able to use equity or find the funds, get the property up in order, get the water running, electricity in the basement, the illegal construction in the attic taken away. So it sounds like if the property is back in order, he can have his house back, right? But who is the receivership? Because again, this is my first time, I don't know.
So I hate to give the lawyer answer, but it depends. But it's true. So what happens is a receiver is basically either an attorney or a project manager or GM or some sort of contractor appointed by the court. And the courts typically have their own list of approved receivers, so it's not some fly-by-night contractor, right? So it's essentially someone who is appointed to take charge, because absent its involvements, the work will never get done. So it's someone with experience in the fields, who is able to, I think the statute is Chapter 111, Section 127I. They're able to borrow funds, they're able to go through, they could even rent the house if they wanted to, right? And so they're able to pull permits on behalf of the owner and get the work done. Does that kind of answer your question?
Yeah, and just very briefly, how does the receivership how do they get compensated? Is it like how does a receiver get compensated?
So what happens is essentially the city will be a petitioner for, to enforce the state sanitary code. They will petition the court. The court will appoint a receiver who either will have his own counsel or, has done this enough that he doesn't need counsel. The receiver then goes back and forth and files status reports, usually every 8 weeks with the court to kind of stay on track. Part of what the receiver does is before the work begins, they submit they do a motion for a budget and approval of the scale of the project. And so baked in there usually is some sort of receiver's fee, and it can vary. It could be, I think usually it's up to the court on what they pay, but certainly it's never anything outrageous. It's enough to compensate the person, putting their time in there, right? But usually, at that stage, when there's a motion to approve the budget and scope of the project, all the parties have a chance to weigh in on that, and they can oppose it. So, kind of the way I look at it is the receiver is meant to bring the property up to code, but doesn't have to make it into a palace. So if Mr. Bassell says, look, I need you to fix the pipe there, I don't need you to put in marble countertops, I don't want to pay for that, right? He has a chance to oppose that, so he can oppose the scope. Every receiver is different, and I wouldn't represent this receiver, so I wouldn't know, but whatever fee structure they have would get baked into there, and at that point in time, the parties would be able to challenge that if they didn't agree with it.
Okay, thank you.
Sorry, just one question. How much time does the social services have before this?
It kind of depends on the courts, so we did file this week to go through. So there's a number of unascertained errors, I think. Mr. Bassell alluded to his father and brother his stepfather and brother being on the deed, I think. So title is not entirely clear. There are some parties that have to get served, and we have to maybe track them down, although with a conversation with the occupants, hopefully I can nail those people down and figure that out. I would expect to be probably before a court within a few weeks. But at the same time, by the time we're before the court, if he's able to represent, look, I'm working with this program, this is our plan, we have something to hang our head on, the court may say, okay, I'm not going to appoint a receiver, I'm going to let you try to do the work. It kind of depends on who moves faster, Okay.
Great. Any other questions? Any of them? Okay. All right. Yeah, so we'll just have to vote here. And this is never an easy thing to do. But I'm going to have to put my vote in first that, I'm going to have to approve the condemnation for the 71 Pitcairn Street and work to try to get things going as soon as we can in any way we can help. I just need a vote from the other members.
Okay. I also approve of the recommendations. Yes.
I also approve and wish you the best of luck in getting this resolved.
Yeah. Okay, all right. Next part go ahead, Tony, sorry.
If I could just ask, so what I would ask is that you guys endorse, I think it's Exhibit A, we have 2 orders for you. It's a finding that the property is unfit for human habitation and a condemnation order. If the 3 of you could just endorse one copy and provide it to me, I'll get that served in compliance with the sanitary code. Okay.
Yeah, no problem. Thank you.
Thank you.
All right, next we're going to discuss some licensing of the City of Revere. Do you have those, or Michael? Okay.
Thanks, Dr. Bunker. Tonight we have 6 licenses that need to be approved by the Board of Health. First one is a body art establishment application submitted by Browse by Camilla, Maria Nito. Submission date was on April 5th of '24. Inspection date was April 18th of '24, and the result of the inspection has passed. Public Health and Inspectional Services Department recommendation is to approve this license. Next one is also a practitioner application, an individual practitioner application for the same person, Maria Nito. Submission date was April 5th, 2024. The inspection date was April 18th, 2024. Her inspection passed, and the result, Public Health and Inspectional Services recommendation is to approve this license. Next one is body art establishment application. It was submitted by Face, Lip, and Brow Bar, Andrea Medina. Submission date was March 18th of '24. The inspection date was April 9th of '24. Her inspection did pass, and the Public Health and Inspectional Services Department recommends to approve this license. Next one is a body art individual practitioner application for the same person, Andrea Medina. Submission date on March 18th of '24. Again, her inspection passed on April 9th, and Public Health and Inspectional Services Department recommend that this license be approved. We have a 1-day temporary license for a body art establishment application submitted by Letter Rip LLC and Boston Harley Davidson, located at 649 Squire Road. The submission date was March 28th of 2024. The The inspection date was April 9th of 2024. The event date is May 11th, 2024. Her inspection did pass at her establishment. The Public Health and Inspectional Services recommendation to approve the license. We also have another one-day temporary license for a body art individual practitioner application by David Martinelli. His submission date was March 28th of 2024. The inspection was April 11th of 2024 for the same event date of May 11th, 2024 at Harley-Davidson. Public Health and Inspectional Services Department recommends to approve the license. That's all we have.
Great, excellent. So we'll sign off on those and approve those. Can I just get approval from the rest of the board members, verbal?
Okay, I approve of the recommendations.
I approve as well.
I approve as well. Okay. Great, that's it from this meeting. Thank you all.
Nope.
Oh, no, it's not. I'm sorry.
That time of year again, Dr. Bunker, where we have heating variance requests.
Sorry.
So I'll explain to, because we have new board members, what a heating variance request is. We have a number of buildings in the city, mostly condominium and apartment complexes, that run off of one heating and air conditioning system for the entire unit, where the newer buildings that are built today are able to, they have heat pumps in their units, and they're able to control their own heating and air conditioning within their unit. We have 6 applications before us tonight for buildings that have requested a heating variance. So the heating variance under the state sanitary code, the building is required to provide heat from October 15th to May 15th. So as we are in climate change, these buildings are typically down beachfront where the sun is beating on them all day. With climate change, it's getting warmer earlier in the spring and staying a little bit warmer later in the fall as well. So what we do is give these buildings an opportunity to apply for a variance to be able to switch over from heat to air conditioning sooner than what the state sanitary code requires. Tonight before us, we have the Breakers condominiums at 474 Revere Beach Boulevard. They have requested a heating variance from May 15th through October 1st. Friendly Garden Co-op, located at 235 Revere Street, has requested a heating variance from May 15th through October 15th. Seaview Towers, located at 510-515 Revere Beach Boulevard, has requested a heating variance from May 15th through October 1st. Sea-Watch Tower condominium, located at 376 Ocean Ave, has requested a heating variance from May 15th through October 1st. St. George condominiums, located at 350 Revere Beach Boulevard, has requested a heating variance from May 15th through October 15th. Ocean Gate Tower condominium, located at 382 Ocean Ave, has requested a heating variance from May 15th through October 1st. I recommend that they all be approved, as they have been in the many years past as well.
Okay, yes, I approve of the request.
I also approve the request.
I also approve of the request.
Great, thank you. That will conclude this meeting. Thanks.